At the bedside, again compare the medication label with the MAR. Discuss the purpose of each medication, its action, and possible adverse effects. Allow the patient to ask questions. Find out where the